Up next, Republican Congressman Gregg Harper of Mississippi, who has a personal reason to get involved in health care reform. His son couldn't get insurance.
Livingston was misdiagnosed with mild cerebral palsy and was said to be a near miss on autism. Almost 2 years later, Livingston was tested and found to have Fragile X syndrome.
We'll talk to Congressman Harper about his son Livingston. Up next, I'm Jennifer Griffin. The health care reform debate rages on here in Washington. Joining us today to discuss the latest and to share the personal story of his son, who has Fragile X syndrome, is Congressman Gregg Harper of Mississippi. Congressman, thanks for speaking with us today.
Thanks, Jennifer. It's a privilege to be here, and thanks for having us on today.
Well, thank you. A lot of Americans don't know what Fragile X syndrome is. I remember being tested for it earlier this year when I was pregnant. Tell us briefly what it is and why your son, Livingston, couldn't get covered for 8 years under your health insurance policy.
Well, Fragile X syndrome is a genetic abnormality that results in a host of problems. You can have the appearance, like we did, of mild cerebral palsy, some autistic type behavior, but it's not autism, although it can be diagnosed in some situations. Speech and language delays, gross and fine motor skill problems, a whole host of intellectual disabilities all rolled into one. And so a lot of times these things go undiagnosed, or in our situation, misdiagnosed for a period of a couple of years. And so the studies that were last done in 2004 indicate that as many as 1 in 130 women could be carriers of the Fragile X mutation.
And why couldn't your son get health insurance for 8 years? And what is it about this new health care debate that might fix that situation for others who have this disease?
Well, Jennifer, obviously when you're raising a child with special needs, and our son Livingston is just a wonderful, wonderful kid, but when I changed jobs back in the mid-90s, the insurance that I had, I could not carry him onto the new health insurance that we had, and we went through this for a period of years until about 6 years ago when I became a city prosecutor. And so there are many families that struggle with this idea, and I think one of the situations we have here, Jennifer, is that we really don't want a Washington bureaucrat or a bureaucratic agency or a health insurance bureaucrat making the health care decisions for our families. So any plan that we come up with needs to make sure that these families, these kids, are not left out of the equation.
But isn't the president's plan and the Democrats' plan essentially to try and create an umbrella so that a situation like your son faced doesn't occur to other Americans, where pre-existing conditions doesn't keep you from getting health insurance? What's wrong with what they're trying to do?
Well, what's wrong with what they're trying to do have to do with a number of issues not related to that particular thing. There are many things about the healthcare situation in America that are good. We don't want to change those. For instance, we have the best doctors and hospitals in the world. We don't want to do anything to change the good health care that we have and that access that we have to good health care. And so I think what's happened is the numbers that have been thrown out are suspect. 47 million people that are said to be uninsured. That number, I believe, is very much inflated because it includes people who opt out that don't want insurance for some reason. Perhaps their spouse has it through their employer. And you're also looking at having a health care commissioner that will be making health care decisions. The aspect of, I mean, do we really think that a government-run health care plan is going to be fairly competing with those that have private plans? We're not gaining anything if we insure the ones that are uninsured, and we lose those that have private insurance and force them into the government plan. So, Jennifer, I wish that we would work on getting something that 435 members of Congress could agree to, not 218, and come up with a disaster of a plan for our country.
Okay. Thank you very much, Congressman Harper.
Thank you, Jennifer.